will get started here. Can you all see the PowerPoint that I just put up? Okay, great. Thanks again for joining our City Health Dashboard virtual office hours today. I'm Becky Ofran. I'm the Manager of Engagement and Partnerships for the dashboard. I'll just do a quick introduction and then turn it over to our featured partners today from County Health Rankings and Roadmaps. We're very excited to have them on board here today. If you haven't joined our virtual office hours before, we're so glad you're here. These are meant to be small, hands-on, interactive webinars where you can learn a little bit more about the dashboard if you're new to it, learn a little bit more about a featured partner that we've been having on more recently, and also get into questions that you have from your community, either specific about the data or really putting the data into action, which we'll be talking more about today. I'm joined by Sammy Breslin from the dashboard, who will cover some content a little bit later on. And if you could just maybe in the chat, just tell us what city you're in, and you'll get to meet our County Health Rankings partners a little bit later on as well. So we'll have plenty of time for questions later, so you can be starting to think about those. Feel free to put them into the chat as we're going, and we'll get to them after we hear from everyone, or you can, when it's a small group, you can also just unmute when it comes time for Q&A later. So just to dive in here as an intro, if you are not familiar with the dashboard, our goal is really helping mayors, city leaders, community organizations improve the health of the citizens in the community. And, a lot of data on health and the drivers of health are not organized at the city or neighborhood level, but rather at the county, state, or national level, which is helpful in some contexts. And sometimes you really need that city data. So that's where the City Health Dashboard came in. And we started out with data for the largest 500 cities. And as of last year, we expanded to over 750 cities, including all cities over 50,000 population. We developed the resource with our team here at NYU School of Medicine, Department of Population Health, in close collaboration with NYU Wagner School, National Resource Network, National League of Cities, and ICMA. And we worked closely with those city partners on measure selection, website development, implementation, and user testing to really create an easy to use resource to help create healthier and more equitable cities. And the dashboard really helps bring to light issues that locals might feel about their cities and neighborhoods, and really confirms that in the data. You can use the dashboard to compare health gaps across neighborhoods and dig deeper into what is causing those differences. And because we pull from national data sets, the data is comparable across all of the cities on the dashboard. So you can really compare your city to other places in your region or with a similar population or city type or demographic factors to help you set goals and really learn from what others are doing. As well as setting priorities and better targeting resources like ARPA funding that is flowing into cities to help recover from the COVID pandemic. And we'll actually be covering that and how cities can use data for that spending in our next virtual office hours next month. So like I said, we pull data from national data sets that really reflect public health priorities. We actually use county health rankings as kind of a model of what measures to include with the social determinants of health framework. And we really want data that is amenable to city level intervention. So, issues that cities can really make decisions based on this data. We update the data regularly based on when the underlying data sets are updated. We actually have a data release coming next week. So you'll be able to have updated data on a number of our measures, which are shown here. But there will also be a new measure. We're adding broadband access, which I know was new to County Health Rankings in their last update as well. So we're excited about that. And again, that's coming next week. So I'll stop there just as kind of the intro and background, and we will turn it over to our colleagues at County Health Rankings to tell us a little bit more about what's new there.
Great, thank you, Becky. I will go ahead and share my screen. And then we'll start with just some quick introductions on our end as well. So my name is Michael Stevenson, and I am the Evidence and Policy Analysis Team Lead at County Health Rankings and Roadmaps. And I'm joined by two colleagues today that I'll have introduce themselves.
Hi, everyone. I'm Kirsten Frobaum. I'm an evidence analyst on the same team at Pop Health Institute and County Health Rankings.
Hi, everyone. My name is Ben. I'm also an evidence analyst at What Works for Health with County Health Rankings and Roadmaps.
And today we're going to spend most of our time talking about What Works for Health, one of our tools at County Health Rankings and Roadmaps. But before we dig into that, we'll talk a little bit about who we are. So as many of you know, we are a program of the University of Wisconsin's Population Health Institute. And this program is a result of the contributions of many colleagues and partners across the state of Wisconsin, but also nationally, including our funder, the Robert Wood Johnson Foundation. And at County Health Rankings and Roadmaps, we're committed to improving health outcomes in communities across the United States. And ultimately, we strive for people to live longer and healthier lives. And equally important to that commitment is our commitment to health equity, which means that we work to assure that everyone has a fair and just opportunity to be healthy. And advancing health equity requires us to really understand the multiple drivers that influence health and remove the obstacles that are preventing communities from achieving optimal health, like poverty and discrimination. And to accomplish both of our goals, we support communities in using data to better understand how healthy their community is and what might be driving good or poor health. We also support communities in using evidence to select policies, programs, and system changes to make sure that everyone has an opportunity to be healthy. And this is the area that we'll really be focusing on today. And then we support communities in using guidance to help stakeholders take action to create that meaningful change. I'm going to take just a minute here to show you a short video that further describes how we think about health at County Health Rankings and Roadmaps. And understanding our model is really essential to understanding the resources that we have available.
We all have a role to play in shaping our community's health. There are so many factors that influence how long we live and how well we live. Think of all the things that affect our health. Sure, we could all eat better, move more, and make sure we get our annual checkups. But there's more to it than that. The quality of our homes, the safety of our neighborhoods, and our chance at a good education all influence health in the short and long term. But how can we understand how all these things fit together? Meet the County Health Rankings model. The model illustrates a broad vision for health. The model shows us that policies and programs play an important role in influencing the health factors that, in turn, shape a community's health outcomes. That means not just how long we live, but also how well we live. Health is complex. The County Health Rankings model helps us see all the factors that impact health and understand where we can take action so everyone thrives. Visit countyhealthrankings.org to get started.
All right, and then before I hand it over to Kirsten to talk about the What Works for Health tool, it's hard to have a presentation without County Health Rankings and Roadmaps and not acknowledge the data side of our program. So we just released updated data at the end of March, and we assess the health by a number of factors, many of which we share with city health dashboards for nearly every county across the United States. And there's a couple of things that I wanted to mention that's different about this year's refresh. So one of the things that's different is that we have two new measures. One is around high school completion rates, which replaces high school graduation rates. And this is a measure that actually I think is now aligned with city health dashboards, which makes comparing data between the county and city level potentially easier. And as Becky mentioned, we also added a measure of broadband access, which measures the percentage of households with broadband internet connection. And this is a measure that we had been exploring for some time, but obviously really leaned into and realized how it further affirmed how important this measure is, especially in the time of COVID. And then another kind of change that might feel subtle on our website is that we added quartile displays to each of our county profiles. And this is really to encourage users to focus on the data that underlies the ranks and to focus less on the ranks themselves. This is particularly useful because many states and counties end up spending quite a bit of time thinking about where they rank in relationship to another county when there oftentimes can be little statistically meaningful difference between those counties. So this is really just a slide to say, if you haven't looked at your county's data in a while, it's worth going back to our website and learning more and seeing some of these new measures reflected in your profile. And with that, I will pass it over to Kirsten.
Thanks, Michael. So Ben just dropped in the chat the link to the 2021 rankings refresh. And I'll share also the link to our interactive model on the website, which is kind of nice if you want to poke around how the factors pan out in different policies and programs to connect the What Works for Health tool with our data. So I'll talk a little bit about the What Works for Health tool. I expect that some of the people on the call are already familiar, but if you have any questions as I'm talking, just go ahead and drop them into the chat and we'll try to address them after. So the aim of this tool is to support community change with evidence. Michael, if you want to go to the next one. Perfect. So just to orient you on the City Health Dashboard website, we're hosted under the Take Action page, and you can use the filters that you'll see on the left-hand screenshot here to say find strategies like green space and parks is one of the ones that will pop up for you. And the screenshot on the right side is what the strategy looks like on the link out on our website. So we actually also live under the Take Action section on County Health Rankings. So hopefully that's pretty easy for you to find us. You can go ahead to the next one then, Michael, thanks. This is the landing page on What Works for Health on County Health Rankings, if you've not seen it before. And the health factors from the County Health Rankings model are in this orange box here, and we use these as topics to organize the different policies and programs, of which there are over 400 now on the website, and we call them all strategies. And these are what's being pulled onto the City Health Dashboard website as well. So just to give you a sense of what we think of how we think of ourselves in the landscape of this work, we're an evidence clearinghouse, or this What Works for Health tool is an evidence clearinghouse, so distinct from like a think tank or the work of an advocacy organization. And there's only a handful of these public health clearinghouse tools that look across a broad set of health factors. There's a lot that focus on single topics like education. But what makes ours unique among those is that we do this comprehensive review of literature or evidence behind each of these policies, programs, and system changes that we then feature in the tool. And our database includes strategies that have limited published evidence, as well as those that have been shown to be harmful or ineffective. So we don't really exclude those. We're hoping that our ratings will guide you toward what works, but we also want to accurately show you what's being tried in the field. We have a longer paper on this if you're interested in kind of the nitty-gritty of some of these methodologies and where we sit in this landscape. So given that there's all this growing attention on evidence and evidence-based decision-making, what do we mean when we talk about it? So there's no universal definition, but for our ratings, which you'll see an evidence rating on each strategy, we give greater weight to what's considered this gold standard of evidence. So things like systematic reviews and meta-analysis, randomized control trials, and then strong experimental designs that are happening in communities and for federal programs. These kinds of studies are really important in thinking about evidence and what constitutes strong evidence, especially when communities are scaling up an intervention, investing a lot of time and money, and especially when political stakes for success are high. I'm sure that's not a surprise to anyone here. But this isn't the only evidence we consider. From here, we kind of look at things like reports, thinking about what might be promising, but isn't maybe being published or has been kind of historically excluded from academic lines of research. So just to give you a sense of where we're going. So then for our strategies that we feature on the tool, thinking back to the green space and parks one I showed at the beginning, I'll kind of just use that as my example. This is what's in each of the write-ups for the strategy. So we have this evidence rating at the top, which is this kind of like green temperature bar. And this rating tells you, hopefully, how likely a strategy is to work. So green space and parks is rated some evidence. For this, that means that increasing green space and parks has been shown to increase physical activity, which is this rated beneficial outcome in the orange box at the very top. So it's been shown to increase that, but there's not enough systematic reviews and experimental studies to say that by itself, increasing green space and parks is going to increase physical activity. There will be some effect, but it's potentially stronger within a package of strategies. So, and then in this evidence of effectiveness section, that's where we go into where and how this has been shown to work to improve health and all the details for local context. So these are our, zooming out, our evidence ratings overall. So these are all the different things that we can rate different strategies. From scientifically supported, which is our strongest rating, expert opinion, which is getting into that promising theory, limited practice, but there's some publication coming out to suggest things work, all the way down to this evidence of effectiveness that I mentioned for programs that have been proven conclusively to not work or even to cause harm. And again, this is a guide. So thinking about strategies that are rated mixed evidence, I want to point out there that this could mean there are mixed outcomes, and considering the local context would be really important. So definitely don't avoid those, but just kind of go in with that caution of like, what's my setting? And then Ben will share this link to our methods page if you're curious what actual, like, what papers do we need to kind of rate something scientifically supported or vice versa. Yep, and that's our methods page there in the chat. So going back then to like, imagining if you're scrolling down on this green space and parks page, you'll see the other features that we have for each strategy. Each one will start with a description, which is helpful in clarifying things like, what do we mean by green space? Because it's not, I actually wrote this one and it's not the same for all different types of researchers, or not considering them the same way. So how are we thinking about it here? I think parks is slightly more straightforward. And then we also, a little further down the page, have this impact on disparities rating. And this can be no impact on disparities is likely to decrease disparities, or likely to increase disparities. And this one for green space and parks is a suggestion that as a standalone strategy, it's not likely to move the needle based on the evidence that we have available. There's a lot of different nuance to local context that, depending on how this is implemented, there could potentially be some impacts, and that's discussed in this strategy entry. So finally, this last section, implementation, is one that I always get really excited about because it's such a cool chance to see communities and across the US that are actively working on these strategies and trying them out and reporting their results. And we have all these resources compiled here in the implementation example section. We also discuss laws there, if there's anything prohibiting a strategy or encouraging it, like grant programs. And then a set of implementation resources. This is usually like workbooks, guides, other things that have been published to help communities think about how they could implement this. So we're also always looking for examples. So if you are an expert in one of these subject areas, or you've come across a really great example from a community, definitely share it with us. We're always happy to add that. And then the last resource I want to point out to you in conjunction with this What Works for Health tool are our curated strategy lists. And these are new. Our analysts have been putting these together. Each of them has a specific theme, and they often include strategies from across health factors. So for example, the climate change list, you can imagine that there's a broad range of strategies that can address this topic and that relate climate change and health together. So this is one thing that we're hoping to offer users to kind of get them to what they need a little bit more quickly. So hopefully this gives you a sense of more of the depth and breadth of our tool. We've got the over 400 strategies now that get updated on a fairly annual-ish basis, depending on what health factor we're working in. And then evidence ratings for each one, and then these curated lists. And I'll just wrap up then by saying that I really love this idea of the What Works for Health tool and county health rankings working in tandem with the city health dashboard and city level data. Happy to talk about kind of what this means to me in the Q&A, but we're just excited to be working with you and supporting communities moving into this future where everyone is truly thriving. And I think we're really resource rich, both in the Midwest where I'm based, but also just nationally. And yeah, excited to be here today thinking about solutions at both of these levels. So thanks so much for hosting us. Looking forward to your questions.
Thank you, Kirsten. That was great. And I did not know about the curated strategies list either. I love that idea. So it's getting my wheels turning for things that we can also offer on the dashboard. So let me just share my screen. I'm just going to do a quick demo of the dashboard, just kind of going over what you can find on the dashboard, how you can find it, and then tie into our Take Action Center, which is where we host all of the, or sorry, not all of them, but a good number of county health rankings, What Works for Health resources. So can everyone see my screen? Great. So this is the City Health Dashboard website. As Becky mentioned earlier, we are a completely free, accessible tool to anyone who wants to come onto the site, explore it. As long as they have an internet connection, they can access the site and all of our features, all of our data. Just come to cityhealthdashboard.com, and this is our homepage. You just enter your city. I'm going to focus today on Salinas, California. And once you enter your city, you're brought to this metrics selector, which is just has all of the metrics that Becky mentioned earlier, kind of all together. And, let's just say, what you are interested in looking at. If it's high school completion, you can click into that. But we also provide an overview or, an at a glance look of a city's performance over all of our metrics and all of our 5 domains. So you can easily see, where your city, is doing well and where those opportunity areas might lie. And you can click into each of these metrics to get a little bit of information about the metric, a thumbnail image, and then you can click in. I'm interested in exploring housing cost today. And one of the great things about the dashboard is that all of our metrics detailed pages all look the same. So no matter what metric, no matter what city you're looking at, once you kind of have a handle on the symbols and the layout of the dashboard of the page, you kind of know, you know it all. And so we kind of build in a bunch of different, what we call signposts to help orient users, orient people to what they're seeing and all of the information that we provide, because there definitely is a lot of it. And we want to make sure that we support users in that way, especially those that are not as experienced data users. So if I just scroll down, this scale bar here represents the range of values for that metric and in that city. So across all of the dashboard's metrics, darker colors indicate poorer outcomes and lighter colors indicate better outcomes. And this blue check mark in the circle will indicate the direction of better outcomes. So for the example of housing costs or excessive housing costs, we want lower values for that. We want less people to be experiencing housing cost burdens. So the blue check mark is at this end of the scale, whereas for a metric like high school completion, for example, the blue check mark will be here because we want more children graduating from high school. This gold bar here represents the city or the census tract value for that metric. And then this navy triangle and number represents the dashboard city average. So in the case of Salinas, 45.9% of households are experiencing excessive housing costs compared to 35.8% across the dashboard's 766 cities. And this green check mark will be present when the city or the census tract average is better than the dashboard city average. So in this case, Salinas is doing a little bit more poorly, so we're not seeing that green check mark. And then I also just want to mention that we provide multi-year data for around 30 of our measures, and you can toggle between years by clicking the 2018 here. And for this metric, we actually have data going all the way back to 2013. And as Becky mentioned, we have a data release coming up where we will be updating all of our ACS metrics, which excessive housing costs is from the American Community Survey. So we will actually have 2019 as well starting next week, which is really exciting. And then just scrolling down, we can see the neighborhood map of Salinas' excessive housing costs. This is my favorite part of the dashboard. You know, the data points, the statistical numbers, they're obviously so powerful and so important, but for people sometimes for those numbers to really resonate, they need to see the visualization of how those numbers play out in the community. And these census tract maps really, you know, you can clearly see which neighborhoods are struggling, which neighborhoods are thriving, as well as general trends across the city. And you can click into each of these census tracts or neighborhoods to get more information on their specific metric percentages. And then you could it just gets pulled to the side here if you click in. The dashboard also provides demographic detail for around 1/3 of our measures. You know, that holistic 360-degree view of community health is so important, and especially understanding how different racial ethnic groups compare to one another and how those outcomes are so different is one part of that process of understanding what's happening on the ground and what communities are facing. And so we provide that, like I said, for about 1/3 of our measures, not for excessive housing costs, but you can find a lot of that sort of information on which metrics we have that data for on our About page. So I'm just gonna kind of keep going across the navigation bar here. You know, for a lot of cities who, especially those that are smaller and more mid-size, as Salinas is, you know, they're not the first ones that are dealing with this sort of problem. There are peers that they can identify to help them understand like what's happening in that city, maybe set benchmarks for their own progress, and then also just to invite collaborations, invite partnerships where possible and where relevant. So we provide users a couple ways to identify peer cities. You know, you can enter the city yourself. Like, let's just say a practitioner is interested in Fresno, which is another California city in that middle part of the state. And you enter Fresno and the dashboard pulls Fresno's scale bar on the page. But let's just say you don't really know what cities you should compare yourself to. Are there cities in the same population band in a similar area? Do they have a similar demographic makeup? So we provide a list of criteria that users can filter based on their own interests, their own priorities to identify those peer cities. So I will just do, for example, population size, location, and adjacent states. And as I kind of did more criteria, you saw, you know, the dashboard kind of filtering, identify more nuanced comparisons based on those filtering criteria. And so if I just click into, you know, maybe Tempe, Reno, again, the dashboard will pull those city scale bars so you can really easily see how all of these different cities are comparing to one another. And then compare metrics, another one of my favorite dashboard features. As we all know on this call, so many of the issues and challenges and focus areas that we kind of highlight on the website, but that County Health Rankings also highlights, these are all really complex, nuanced challenges that don't exist in a silo. They don't exist kind of in their own narrow box or their own narrow lane, and they're very interconnected, interrelated to other challenges that neighborhoods or communities might be facing at the same time. And so the dashboard allows users to choose other metrics to compare with that main one. And just to see how potentially two metrics might be, you know, what those trends are across neighborhoods of a city and what communities are facing. So I will choose uninsured because that is obviously, as we know now in this year, after this year, you know, the uninsurance rates are high, excessive housing costs is also extremely high, and these things go hand in hand. And so the dashboard, the way we present all of this info is pretty similar to what we just went over on the metric detail page, where the bottom layer of that map, those blue polygons, indicate our original metric, excessive housing cost, and these pink dots or these red dots indicate the comparator metric, so uninsurance rate. And like before, darker colors indicate poorer outcomes. So the yellow dots the pink dots for uninsurance rate means that the uninsurance rate is lower there, versus the darker red means that insurance or uninsured rate is higher. And as you can see, and as you might expect, those areas that are really struggling with housing cost burden also have high uninsurance rates. And again, you could just click into each of these metrics and it gets pulled to the side. And then before going into take action, just because I'm going to spend a little bit more time there, I do want to bring your attention to our data access page. All of our data across all of our measures and all of our cities is available for download in a couple ways. You can either download CSV files through this page right here, but we only provide the most recent year of data available on those CSVs. Or if you're an experienced data user, you can access our API, which is where you're able to pull multi-year data, as well as more specific data pulls, data criteria pulls. But moving on, I do want to spend time on our Take Action Center, which can be accessed through the main menu or through the navigation bar at the top. And when we launched, we heard a lot from users, all of this data is so great. I kind of know now where the challenges are in my city, and I want to start, trying to move the needle, trying to do something to drive change. But what can I do? Where can I begin? And so we created this Take Action Center, which has, a wealth of resources, over 400 resources across all these 5 different domains to really help users understand how to move from data to action. And we have Find Policies and Programs, which is where you'll find a lot of the What Works for Health tools. We have them, as Kirsten kind of showed in her demo, they're all listed here. These are all organizations, websites, platforms that we trust, that are experts in their field. And, this is a chance to highlight that research, highlight those evidence-based strategies that a lot of different groups are working on and doing amazing work on as well. County Health Rankings being one of those tools. So we have, just in this one bucket alone, over 350 different resources, different policies or programs that are either promising or evidence-backed, as kind of Kirsten went over that matrix in her presentation. And they're all kind of listed here alphabetically, but you can click in to each one. And for example, I just clicked into active recess, and this will bring us right to the County Health Rankings page for that specific resource. And so you can do that with any of the resources that we provide. And so these are our Find Policies and Programs. You can filter by metric, by audience. If you're, a community organizer or a local business person or a government official, you can find resources that apply to that specific audience, which is really great and really helpful. And again, just helps, it just provides that specificity to really use this data and put it into action and really practical applications of the data that we provide. We also provide resources and tools in these 4 buckets, which are how you can do it. How can you actually implement the policy or the program that you find from County Health Rankings? So Find Partners, is pretty self-explanatory. How can we expand the seats at our table? Who can we collaborate with? Who can we bring into our fold? Explore Strategies has things and toolkits like communicating effectively, how to visualize data, how to talk about the social determinants of health with lay people. Find Funding there's never enough funding, so we provide not only resources where organizations or governments can go to actually find funding and find stuff like that. We also provide guidance on how to apply for that funding. So we also provide that next step, that next guide. And then measure impact. Also pretty self-explanatory. Once you have a policy or program in action, how can we actually learn how to evaluate that program and make sure that the impact that we intend to have is the impact that is actually being felt and experienced by the community? And that goes into the piece that Kirsten talked about, that evidence, the base, that evidentiary support that is really, really important to have, especially when kind of looking for funding and advocating for specific policies and programs. And so with that, there's a lot here. I will yield the floor and stop sharing my screen, and we can take questions. Sorry, I'm just trying to figure out how to stop sharing. Okay, stop share. Never a dull moment on Zoom. I'm just going to check the chat really quickly. So we just got a question. Would love to know how often County Health Rankings updates the implementation examples. Can communities use that section to see which strategies have been used elsewhere and to even connect to talk with them further? So I will obviously yield that to the County Health Rankings crew.
Thanks, Samantha. Yeah, I'd be happy to answer that. We usually update the implementation examples definitely when we update the entire strategy entry, which I would say there's not like a strong rule for this. It really depends on kind of what research is coming out and what is most important to our users. Every 1 to 3 years, you'll see those like page last updated or last evidence review dates on the website. But we can also update the implementation examples very easily in between those major page updates. So I often come across things in the news or, kind of just see hot things on listservs that I'm on. So if you have ideas, we can usually add them pretty much in real time or kind of on like a rolling basis, I would say. And as far as connecting to talk with them further, yeah, we definitely encourage that. That's part of the reason that section is there. Is so if you want to reach out to the communities doing the work, that hopefully in the resources that are provided, you can find either a contact information or like at least pages to start with to look for it.
Great, thank you. And then one question that came in, so you just kind of mentioned this, Kirsten, if you see like a news article or someone kind of writes into you, you can add resources to the page, but is there any, like what is the process for kind of finding these resources and kind of identifying which ones that you want to actually put onto the website? Just kind of go into that process.
Yeah, so similar to our evidence review for the body of the strategy itself, we have a kind of like a systematic process that we go through to search like a standardized set of databases and websites, both like published literature and like kind of the gray literature reports, things that are coming out directly from organizations. So we do that systematically every time we do the big strategy updates. And then things like rolling can kind of come in from more local examples. If somebody I know at a department sends me something, we can add it that way. But we try to offer a broad representation of examples. Something that is near and dear to my heart in Wisconsin is as more tribal work is becoming more visible. I think adding those kinds of examples is really both useful to those communities and just useful more broadly across the US to see where work is going on that's not often thought of.
No, totally. And we're also kind of grappling with, and you mentioned this in your formal presentation, there are so many great things that are happening in cities, in counties and towns across the country that might not have that evidentiary support yet. But, where is that line of like including those because they are so helpful, but we are data evidence-based tools, and it's such a balance and tension. But I think we're definitely finding value in providing and kind of leaning into potentially the uncertainty of saying, oh, we want to support this and kind of advocate for it, but also acknowledge that the evidence isn't there, but still kind of highlighting what's happening. Oh, sorry.
Oh, sorry. I was just going to add that I can let Michael or Ben weigh in too, but something I didn't mention is that we lean really heavily on excuse me, experts in the field when there are like promising practices or theory that's coming out. We can do everything from just consulting with an expert to do like a formal review of our write-up and see if they have anything to add. So that's one place where those partnerships are really important.
I bet. Yeah. Finding the experts and acknowledging that we can't do all of this on our own has been it's so key to all of the work. We got one question: where on the About page is the information on those metrics for which demographic breakdown data are available? Great question. I will share my screen again. Okay. So you can find the About page through the menu here. About, sorry if it's a little slow. And then if you click here, 35 measures, it'll bring you to a PDF that you can just download. And if it works, hope it works on
You're
Zoom.
not sharing your screen. Are you intending to?
Oh, sorry. Sorry, thank you. Whoever just said that. Can you see my screen now?
Yeah.
Great. Sorry about that. This all just really quickly. You can get the About page from the main menu here, and then you click this hot link over 35 measures, and it brings you to a PDF that'll get downloaded to your computer. And if it loads on Zoom, it might not. It'll have a whole table of, if the data, oh, here it is. So it has a whole bunch of information on this table, the name of the metric, which domain it's in, the data source, the years of collection, whether or not it's available at the city level or the city and the census tract level. And then also if there's a check mark under race, ethnicity subgroups, that means that we have the demographic data available for it. So great question. And thank you. I think that was Taylor for warning me that my screen wasn't sharing. You'd think after 15 months of being virtual, we would know when that happens. I'm just seeing. Oh, and Becky, sorry, you shared that in the chat. County health rankings, can you talk about the saved strategies feature and how that works?
Sure, I can take a pass at that, and then Kirsten and Ben, please add as needed. But this is a relatively new feature on our website, so we recognize that there's a lot of content available for people to search for, and that we're all kind of curating our own mini lists in some ways as we navigate the website. So once you identify a strategy, there is a little star kind of under the strategy name that really allows you to select that strategy and then do a couple of different things with it. And I'm actually going to bring it up here just so I can show you here. And I'll share my screen as well. One second. Okay, so I am just on the What Works for Health kind of landing page. And so what I'll do is actually search for the strategy that Kirsten had identified earlier. And so green space and parks, let's say I want to come back to that strategy later. I can hit the star and it'll show up in the saved strategy bucket. The other nice feature is that if you go into the strategy, you can also print it. And this is another resource, if you prefer to have paper documents or save it as a PDF to access this in the future. The saved strategies will exist for as long as your, I think, cache is not cleared. So I can go in here and continue to select or unselect the strategies that I have saved. I can view it, download it, or email that list to folks who might be interested, or a partner who I'm collaborating with.
That's great. That's so useful. Any other questions? I think we got to all of the ones that came through in the chat, but if anyone has any questions, happy to yield the floor as well, if you're brave enough to speak up.
one thing I might just offer to the group is that we are in the process of thinking about our disparity rating differently and really trying to expand the equity lens that we review that analysis with. And so over the summer and fall, we'll be doing a number of expert engagements with folks that use our tool, but also have some expertise around equity. And so if anybody happens to be participating in this call today that's interested in learning more about that work, we'd love to hear from you. So I'll put my email in the chat, and please do reach out if that's of interest, and we'd love to learn with you and from you as we engage in that process.
Great. I'm not seeing anything in the chat. Oh, but thank you for reminding me. I want to put our email as well into the chat. We check this regularly. Oh, we got one question. Are previous office hours archived online? Great question, Ronald. Yes, they are. I will put that in the chat as well. We have a virtual office hours page where you can find out about upcoming virtual office hours, as well as access our previous recordings of office hours. I will share that link as well. We have most office hours recorded there. Some are not available, but there's a good, there's at least, I'm looking now, there's at least 6 there that you can review and go back to across a whole bunch of different subject areas. Another great question. Are census tracts the lowest level of geography? For us, at this moment, yes, census tracts are the lowest level of geography, though we are always thinking through other ways or other shapes, as we call them, to provide on the website and to kind of disaggregate the data by. But at the moment, census tracts is, that lowest geography for us.
Ron, in your work, is there another size or type of geography that you were hoping would be represented somewhere?
Great question.
I'm just going to unmute for a second. Postal routes are the most reflective of neighborhoods. And in the work that I do, I'm constantly looking for metrics that I can attach to a neighborhood as opposed to a zip code or a TAZ or a census tract or something like that, because that really doesn't capture the neighborhood sort of experience. But I know the difficulty, being a geographer, I know the difficulties in trying to get to that level. But most of the other geographies that we use, such as census tracts, are just sort of arbitrary boundaries. And I'm doing a lot of work right now in Memphis. And as you can imagine, there are vast differences between neighborhoods. We're one of the towns that are one of the cities that's predominantly Black, but that's not necessarily reflected in our MSA or even city statistics. So it would be a massive undertaking, but we might be thinking in that direction, because that's where stuff happens, is your neighborhood. And of course, we've done stuff at the zip code level and said, what's your life expectancy based on your zip code? But we could drill even further down. So just my thoughts.
No, I mean, great thoughts to have. And like I said, we have a couple analysts from our team on the call as well. And they're always kind of thinking through how can we like drill down and really provide geographies that are meaningful or locally meaningful to communities. But as you kind of mentioned, there's such a tension with finding that data and then having it be applicable to all of the cities that we provide. Happy to have one of our analysts, chime in with anything if they have any thoughts or comments on that, on the postal routes. But yeah, it's a great thought.
I think that's been a tension in this field for a long time. I saw a project a few years ago that was, I think, actually done decades ago in Detroit, potentially, where they used, it was geographers, I think, that led it, and they worked with like locals in the community, including students, to sort of create this mapping tool to represent a variety of measures in the community, including like car accidents, as a way of reflecting the intersection of different neighborhoods and how segregated it was and how that was playing out. So yeah, so I think, Ron, I love that you brought that up, because I think that kind of work and thinking about is really important, and especially how we work with different fields that are not necessarily like traditional health fields like art or like geography, to better help ourselves and communities understand how this actually works in the day-to-day, and how then we can also change it to make it better for everyone.
Totally.
Sammy, I can just jump in.
Great.
Hi, I'm Taylor. I'm one of the senior data analysts on the project. And I just want to echo what Sammy said, that we're really excited to think about other geographies we could add. And Ron, you highlighted one of the greatest tensions that we're facing, especially with postal codes, that there's like a standardized census geography, the ZCTA, that they only change once every 10 years. And then there are the postal code routes that are updated quarterly from the Postal Service, and those are actually a little different. And so a lot of geography data is at one of those geographies, but not both. And so there's a lot of fun geography questions there as well. And if you have any experiences that you've had working with local data around that, we always would love to hear it as we continue to build out our own geography offerings.
Great. Any other questions, comments, concerns? We have just about 5 minutes, so we're almost at time, but there's definitely time for one or two more questions if they come in.
I'll just point out too that Ben and I dropped both of our emails into the chat. I know that often questions don't really come up until you like dig into a tool and try to think about how you might use it. I know grant rating is a big one, or like community health assessments and implementation plans, things like that. We get used for a lot. And yeah, however we can help you curate your own list of strategies, or if you have ideas for where we can fill in gaps in data, I think we'd be happy to have those conversations. So please do reach out.
Okay, totally. I'm not seeing anything come through, so happy to give folks back 4 minutes of their day, but I do want to just thank you to County Health Rankings for joining us today, and just for all the amazing work that you guys are doing over there. I mean, we would not be where we would be without you guys. Yeah, so it's just great to partner with you on this, and hopefully more to come in the future.
Yes, and thank you so much for inviting us. It was really fun to talk about one of our tools, and really kind of echo that sentiment that we work really well together, and there's tons of opportunities when you can put our kind of tools in relationship to one another. So thank you.
Thank you all, and everyone have a great rest of your day and rest of your weeks before Memorial Day.
Thanks so much.
Thanks.
Bye.